Hey everybody, I got a few questions about prejuvenation as a term after the last video on Botox and neuromodulators. So I wanted to spend just a few minutes talking about what prejuvenation is and hopefully answer some questions if you have any. So prejuvenation is not something that's solely related to Botox. It's kind of an umbrella term of something that's kind of a new movement over the last few years. And what it is, it's younger patients that are showing up to the cosmetic clinics for treatments that were usually thought of being held on for people in their 40s or 50s or 60s. And so it's been shown that most plastic surgeons are seeing kind of a surge of patients in their 20s and 30s coming in for treatments like Botox and other things to almost try to get ahead of the aging process. And the idea is that if you start early, it can hopefully help you age gracefully and not have those signs of aging be as strong and as prominent as you do age. So there's many things that fall into the category of prejuvenation. It's not solely Botox. So there's things like fillers, obviously, skincare, so whether that's topical products that you use, laser-based treatments, also light-based like IPL treatments. You can also do things like microneedling and microneedling with radiofrequency, and all these things are trying to improve the quality, the texture of the skin. And I think that's one of the things that's really important and really big that's happening now for patients that are a lot younger than in their 50s or 60s. So we can talk a little bit about Botox and also just in general skincare that are probably the two most important things to talk about in terms of prejuvenation. So why do people get Botox when they're in their 20s? Usually people in their 20s don't normally have lines here in their forehead or around their eyes, or if they do, they're not that deep. And so some thought was that, well, if they're not there, you don't need to treat anything. But there has been some studies showing that by treating the lines and the wrinkles, basically training the muscles before they start causing those lines and wrinkles, and you do that regularly over time, that those lines won't be as deep and they won't be setting in over the course and as you age. And so that even without getting a Botox treatment, those lines at rest aren't as deep, aren't as strong. And so that's the argument for doing Botox early and doing Botox consistently to help prevent those signs of aging over time. Now there's some evidence that's been put out there that does show that does happen. But again, the opinion is somewhat split. But if you are interested in doing Botox and trying to prevent some of those lines from happening and getting deeper over time, then certainly come in for a consultation and we can talk about what those options are and what it would look like. And the other thing I think that's really important to talk about in terms of prejuvenation is just skincare. When you come for a cosmetic consult anywhere, really one of the first things that a plastic surgeon will talk to you about is what is your skincare regimen and how are you taking care of your skin. So obviously there's a lot of topical products that you can use, retinols, retin-A's, you can do medicated creams, you can do non-medicated creams, you can just have a good exfoliating agent, making sure you clean your skin every night and you moisturize very well. But basically having a good regimen with good quality products is one of the best things that you can do to take care of your skin every day. The number one, probably best piece of advice that someone could give you is to make sure that you wear your sunscreen every day. And that's anytime you're in the sun, you should be having at least 30 SPF all the way up to 50 SPF on top of your skin to prevent sun damage. If you did just that and you were really diligent about that your entire life, your skin would definitely not show signs of aging as someone else who did not do that. So if there's one thing that you can take away from this video, it's definitely wear your sunscreen, and any plastic surgeon, dermatologist, or person that's interested in skincare will tell you the same thing. And finally, that is really, in general, all the things that encompass prejuvenation as a term. If there's any questions that people have additionally or on the different kinds of treatments, please let me know. But thanks for watching.